Thank you for taking the time to learn more about your baby's feeding needs and strategies to best support their development, both throughout their NICU stay and as they transition home. The goals of this video are to teach you, the family, signs to look out for before, during, and after your baby's feeding, and strategies for responding appropriately to these signs. In this video, you will learn how to get your baby ready for feedings, how to read and respond to your baby's cues to ensure a safe and positive feeding experience, and how to create a supportive environment for your baby's ultimate development. The ultimate goal is to give you confidence in your feeding interactions with your baby and to provide your baby with as many positive, quality feeding experiences as possible. It is important to remember that this video is intended to provide you with general strategies for both reading and responding to your baby's communication while feeding, and is just a starting point along your family's new journey. Each baby will have individual needs and their own developmental course. Please feel free to express any concerns or questions you may have to the speech-language pathologist who is working with you and your baby. As your baby continues to develop and mature, it's important to look for cues that he or she uses to communicate feeding readiness. Responding to these cues when feeding or promoting feeding readiness is one of the first and most important opportunities to communicate with your baby and to support the development of feeding skills at the baby's own pace. This will encourage pleasurable and non-stressful feeding experiences for both you and your baby. As speech-language pathologists, or SLPs, we are responsible for the prevention, assessment, and treatment of communication and swallowing. As NICU SLPs, we serve the specific role of feeding specialists and work within a team of professionals to provide individualized feeding and swallowing services to both your baby and to you, the family. Our role is to assess, diagnose, treat, educate, and advocate to facilitate optimal development of feeding skills. This includes promoting important building blocks that serve as a foundation for feeding readiness, such as providing opportunities for your baby to practice suckling, also known as oromotor stimulation. Another important means of supporting development of feeding skills is kangaroo care, or skin-to-skin contact, which provides many benefits for both you and your baby. While breastfeeding is the preferred mode of feeding when possible, there may be instances when the caregiver will need to supplement with the bottle. While some of the techniques we will mention are specific to bottle feeding, many of the techniques will also apply to breastfeeding. The aim of this video is to introduce and explain feeding skills and strategies that you can offer to your baby as he or she transitions to feedings by mouth. Our goal is to facilitate confident, stress-free, and meaningful feeding experiences for you and your baby. Bottle your baby with hands at the center of the body, as this is the most natural feeding position and provides stability as your baby feeds. You may want to leave hands visible, as this is one means in which your baby may communicate signs of stress to you. Optimal feeding should occur when your baby is alert. Ideally, hunger cues such as rooting or turning towards the nipple should be present, along with no signs of aversion to oral stimulation and stable physiologic signs. For example, your baby should be responsive to handling and should tolerate input without any signs of increased breathing or color change. When holding your baby, specific handling techniques will allow for greater ease of movement, allowing you to reposition your baby as needed. First, cradle the baby's head in one hand while holding them by their bottom with the other. Avoid placing pressure on the stomach when handling, as this may cause discomfort. This placement also allows you to provide tactile stimulation to the cheek with your upper hand as needed. Position your baby in an inclined side-lying position, with head elevated above hips and body tilted to the side. This allows for better control of fluid, head and trunk alignment, and decreases work of breathing by allowing more efficient ribcage movement and lung expansion. This position will also allow the feeder to visualize the baby's entire face, which is important for reading cues, and neck, which is important for viewing the absence or presence of a swallow. Using the nipple recommended for your baby's individual needs, offer the nipple by stroking the upper lip. Wait for your baby to communicate that he or she is ready for feeding by opening their mouth to accept the nipple. Several attempts may be necessary, but it is important to wait for this cue of feeding readiness before beginning any feeding. As your baby engages in active suckling, it is crucial to monitor their feeding from moment to moment for cues of engagement and, in some instances, for signs of stress or fatigue. One critical technique for responding to these cues is called co-regulated pacing, in which breaks in suckling can be implemented in response to your baby's cues, which may include pauses to breathe, breaks in suction, or any signs of disengagement. By tilting the bottle down, but taking care not to pull the nipple from your baby's mouth, the fluid flow is halted, allowing your baby a pause to reorganize before continuing. This should be continued throughout the feeding in response to close monitoring, tilting the bottle up only once your baby has demonstrated feeding readiness by re-engaging in suckling. While these pauses are largely in response to obvious cues, such as pausing to breathe, keep in mind that breaks should be implemented in response to all stress cues, even if your baby continues to suckle. It is also important to pay close attention to the quality of your baby's suck, which can be monitored by observing the amount of bubble return into the nipple. This is an indication of how much fluid your baby is pulling from the bottle and ensures that feeding remains efficient. Feeding by mouth is an aerobic event for your baby, and one that will take time to master. It is common for infants to fatigue, especially as the feeding progresses. Your baby's cues can vary from subtle to obvious, and it is important to be mindful of and responsive to all cues during a feeding. Signs of disengagement can occur at any point in the feeding, including no active rooting or sucking, difficulty maintaining a wake state resulting in passive feeding, pushing the nipple out with the tongue or pulling away from the nipple, transition to a weaker or non-nutritive suck, similar to the kind of suck you might see with a pacifier. Signs of stress include change in state of alertness. For example, the baby may have difficulty regulating alertness, resulting in transition to a deep sleep or in fluctuating states. Change in postural control. Your baby may present with an open mouth or gape face posture, or extremities may get floppy. Changes in physiologic stability. Though you likely won't have a monitor in the home, there are many indications of changes in respiration and swallowing coordination. Change in color. Increased work of breathing. This can be observed by rapid chest movements or shallow, frequent breaths. Nasal flaring, yawning, sneezing, facial tremors can be in the jaw, cheek, tongue, or all three, hand splaying, chin tugging, which is the infant pulling up or extending their neck, eyebrow furrowing, eye floating or crossing. Changes in coordination of the suck-swallow-breathe pattern may be indicated by loss of bolus control resulting in spillage or loss of fluid, gulping or audible swallowing, coughing or choking. If any of the above signs are observed, modification of the feeding approach contingent on your baby's cues is necessary to allow your baby to maintain or regain stability. Many of these modifications have already been discussed, such as swaddling, positioning, or providing co-regulated pacing to allow for rest breaks as needed. Depending on the cues you observe, you may implement a burping break, allowing for an increased period of rest as well as alertness. If signs of fatigue are noted, alerting techniques can be provided, such as buccal stretching and tapping. Vestibular techniques, such as light bouncing, can also be implemented. If your baby does not re-alert and communicate readiness cues by accepting nipple and engaging in active suckling, feeding should be discontinued until hunger cues such as rooting and alertness are demonstrated. Feeding tubes such as the nasogastric tube or orogastric tube may be needed to supplement your baby's intake. The use of such tubes are a temporary means of nutrition that removes the pressure placed on both the baby and the feeder to complete feedings by mouth until their system has matured enough to complete stress-free feedings. This helps to ensure that feeding experiences remain positive while the baby continues to develop feeding skills and grow stronger. Successful communication can be achieved during feeding by monitoring for and responding to your baby's cues. It is important to remember that while modifications should be gently offered, overstimulation should be avoided. The goal is to provide a pleasurable and non-stressful feeding experience that is guided by the baby. Prodding and other techniques to encourage more intake than your infant is communicating readiness for are not recommended. Forcing the baby to eat can result in altered feeding pathways that result in negative associations with feeding and feeding difficulties later on. By following the baby's cues and letting the baby guide the feeding, we are promoting positive feeding experiences. The feeding should not exceed 20 to 25 minutes to ensure that your baby is not expending more energy than he or she is consuming. Ultimately, the interaction between you and your baby during feeding provides an important foundation for future feeding development. The quality of the feeding should always take priority over the quantity, allowing your baby to set the pace for not only his or her feeding, but for the pleasurable development of their feeding skills.